Yeah, diagnostic testing, it's still a pretty big limitation in the world of IgG4 related disease for doctors figuring out what's going on. We've made a lot of strides with a lot of other autoimmune diseases like rheumatoid arthritis. We have diagnostic tests, or lupus, we have diagnostic tests. These are simple blood tests for antibodies that can help confirm a diagnosis. And most of those are really confirmatory diagnosis after the disease is suspected based on symptoms or physical exam findings. With IgG4 related disease, we do rely a lot on the blood work for IgG4 levels, and there's a lot of limitations to that. IgG4 in the blood could be elevated for a plethora of other diseases. Really, any chronic inflammatory disease could raise the IgG4 level. So it's really not specific to IgG4 related disease. Usually a biopsy is needed for various reasons to diagnose this disease. One of the main reasons we often rely on or need a biopsy is to rule out or exonerate a differential diagnosis like cancer or malignancy. So that's often an important caveat. The biopsy can be helpful to confirm a diagnosis as well. There are features on a biopsy that are more consistent and more compelling for IgG4 related disease, including the number of IgG4 expressing cells on the biopsy. There really is not one test, though, that completely confirms or diagnoses this disease, and it really does rely on a physician putting the pieces together, recognizing patterns, and interpreting all of the data simultaneously. And that data could be from radiology, like a CAT scan or MRI, a biopsy, like I was just mentioning with IgG4 expressing cells, blood work, as well as a history and physical exam of a patient. So it's really a full package that's put together to really diagnose the disease.